Okay. So like I said, antimicrobial agents are just the agents that we use to inhibit growth of microorganisms or to kill them. Now, let's talk briefly about the introduction. Antimicrobials have significantly reduced morbidity from communicable and infectious disease over the years. So there are different types of what? Of diseases all over the world. But due to the fact that antimicrobial agents have been introduced, it has reduced a number of what? Morbidity, even mortality from communicable and infectious what? Diseases. So they are often the largest drug group in developing countries. So this study discusses basic antimicrobial classes, their mechanism of action, the impact of antimicrobial resistance, and how we can what? Curtail them. How we can curtail them. Because over the years, because of misuse, over prescription and so on, there has been a lot of what? Resistance to these antimicrobial agents. So we are going to discuss about them too. So let's briefly talk about the trends. What are the trends in development of antimicrobial agents? So in developing countries, the high occurrence of infectious diseases have led to higher incidence of inappropriate use and resistance compared to developed countries. When you notice that take for instance, in Nigeria, Nigeria is one of developing countries. If you look at the way we use antibiotics or any form of antimicrobial agent, it has been misused. When people are sick or something is wrong with them, they just go to the pharmacy and purchase this medication. People just use them. Normally, all these medications are supposed to be what? Supposed to be prescribed by a professional. But people don't even seek the consent of professional. They don't seek for advice. When they feel that something is wrong with them, they just go ahead and make use because everybody have access to it. So there has been a lot of resistance because of inappropriate use of all these antimicrobial agents. So it has actually affected the way they work, their potency, it has affected the way, the way it treats infection. It has actually reduced it drastically. So there is this particular person known as Elite. So this Elite carried out a pioneer work in 1904. And there's another person known as Salvasan in 1910. They demonstrated the use of what? Arsenical compounds for treating infections. So that was the first substance that was used in treatment of what? Infection. Then the modern era began in 1935 with Domax. So it was this Domax that was able to come up with what we can use to treat streptococcal infection. We all know that streptococcus is a bacterial infection. So he came up with what? Protosil, what is known as Protosil. That was in 1935. So it's a sulfonamide medication. It's a sulfur-based medication. So since then, other drugs have been synthesized to provide a wider range of activity against more bacteria with greater what? Potency, less toxicity, and different physical-chemical properties. I hope we are following me. Please, I need response. Are we following me? Am I making sense? I hope what I've explained so far makes sense to you. Okay, so let's continue. All right. So now let's briefly talk about different groups of antimicrobial agents that we have. When I started this class, I told you that we have different types of what? Microorganisms. And when we say antimicrobial, something that works against what? Microorganism. I told you we have the bacteria, the virus, the fungi, we have the protozoa. So we have different groups. So we are classifying this group according to the types of bacteria, types of microorganisms that we actually have. So the first one I'm going to talk about is the antifungal agents. We are not going to dwell on this because we all know them. We are nurses and we have been practicing for years. So when you hear the word antifungal, we make use of antifungal. Can you tell me the type of antifungal that we use? So from the word antifungal, it's just the agents or the medications that you use to prevent what? Fungal infection. So they are different from antibiotics. So can you just tell me different types of antifungal that you've known or that you have used to treat your patients? The slide is not showing. Can you see the slide? How many people have seen my slide? Please, you can see the slide indicates. If it's not showing, I can. Please type, is my slide showing? It's showing. Can you hear my voice? So if you are not seeing my slide at your hand, kindly check your own network. Thank you. I've seen a lot. Okay, people have typed a lot. Thank you. We have different types of antifungal that we use for fungal infection. So is my voice clear now? Is my voice clear now? I want everybody to benefit. Is my voice clear? So that we can continue. I want to spend less than 1 hour in this class. Okay, so can I continue? Okay. So please kindly check your network. Kindly check your own network. Thank you. So we have all different types of antifungal. So we just use it to treat all fungal infection, all our nystatin, fluconazole, ketoconazole, no, all those and so on, not metronidazole. So we will not go and say, okay, any drug that ends in zone is a antifungal. No, metronidazole is not part of it. So let's take it. Now, another one is antibacterial. So this usually refers to our what? Antibiotics. Antibacterial for no antibiotics are used for what? Bacterial infection. Maybe broad spectrum or narrow spectrum infection. I mean, narrow spectrum. So, you use it for what? For bacterial infection. So a principal type of antimicrobial agent used mainly against bacteria. And it either kills or inhibits them. It is either the antibacterial kill them or what? Or it makes their growth to be static. So these are the two ways in which antibacterial can work. Antibacterial may also refer to our antiseptic. Can also refer to our what? Antiseptic, we make use of all these antiseptic in our world. Antiseptic is a principal type of antimicrobial agent that is used mainly against bacteria. It may also kill or inhibit them. Disinfectants, yes, all disinfectants that we use to impair the growth of micro. We use disinfectant to clean. When you want to carry out a particular procedure, you sanitize your trolley. You want to clean your trolley so that you want to, eliminate any form of microbes that are on it, because you don't want to transfer infection to your patients. Then our bactericides, the one that kills bacteria, bacteriostatic agents, antibacterial. So we have a whole lot of them. So we have different types under these antibacterial. Then another one is antiparasitic. Antiparasitic. What about antiparasitic? Antiparasitic means the agents that we use to treat what? Parasitic infections. So these are agents. These are agents that we use against what? That we use to treat parasitic infection. So these medications, we have different types under it. So we have different types under it. We have the helminths, the Hamweber, parasitic fungi, protozoa, and ectoparasites. We know that all these parasites can either be endoparasites or ectoparasites. So it can be two types. It can be either endoparasite or ectoparasite. And we know that parasites are microorganisms that live on our body or inside another organism. So it either resides outside or inside. If it is inside, you know that is endoparasite. And if it is outside, that is what? Ectoparasite. So it either stays outside the body of their host or inside. So human being can be their host. Anything, can use anything as their host, or majorly human being. So all these antiparasitic agents are the ones that we use for what? To treat parasitic infection. So antiparasitic agents do not work for viral infection. Should take note. We know that antiparasitic agents cannot work for what? Cannot work for viral infection like common cold and flu. Antiparasitics are one of the antimicrobial drugs which can include the following. It can be used against what? Protozoal infection or helminth infection, like all these worm infestation. Then ectoparasites. I've explained that organisms that live externally on the skin of their host. It can also be used for endoparasites. Then they are administered orally as a tablet or as what? Suspension. I hope you are all following me. Can you still hear my voice? Okay, and it's the slide still visible. Okay, so those that said my voice was breaking initially, is it still breaking? Can you hear me now? Okay, so if you are still having problem hearing my voice, kindly check your network or look for a good network so that you can hear me clearly. Then we have the antiviral agents. We have different types. Can we mention the types of antiviral agents that we have? Let's mention them. These are agents that we use to treat viral, that we use for treating viral infections. Antiviral agent, acyclovir. Thank you. Yeah, acyclovir. You can use it to treat chickenpox. When you give a patient with chickenpox, when you give them antibiotics, it will not do anything. To just be there, because viral infection will always what? To always run its course. So the only thing you can do is to give them what? Antiviral. So when you give a patient that has a bacterial infection and give them antiviral, it will not do anything. Thank you. Thank you very much. Thank you. Now let's briefly talk about mechanism of actions. So all these are antimicrobial agents. They work in different ways, diverse ways. So they either work by inhibiting what? Cell wall synthesis. That is one way. It depends. They inhibit what? Cell wall synthesis, or they alter what? Cell membrane. You know that all these microorganisms, microorganisms that we are talking about, most of the time, they carry out most of their action through the help of their cell membrane. So what this antimicrobial agent does is that it either inhibits the synthesis of their cell wall, it either alter it, or inhibit the nucleic acid synthesis. You know, this our nucleic acid now, you know, it can be RNA or DNA. And it is this RNA or DNA that helps them to what? To replicate. That helps microorganisms to what? To replicate. It's more like that's their powerhouse. So when you give them all these, when you use these antimicrobial agents, these are the various or diverse ways by which to work. They either alter their cell membrane, they either inhibit the synthesis of their cell wall, or inhibit the nucleic acid synthesis, or their protein what? Synthesis. I don't want to start reading my slides line by line because I will upload them on the LMS. So you have access to it. So that's why I'm not taking my time to read it line by line. So these are the ways, these are the different mechanisms of actions of all these microbial agents. So please kindly take your time and read it. Then now let's talk about factors that contribute to emergence of resistance. You know, I told you that over the years, because of high occurrence or incidence of various types of infection and all those stuff, you know, people have misused all these antimicrobial agents. People get them without prescription. There has been a lot of abuse. So it has contributed to what? Their resistance. So most of the time when you place people or patients on all these antimicrobial agents, most of the time it doesn't work or it doesn't give you the results that you are actually expecting because of what? Resistance. Yeah. All these antimicrobial agents have built like, okay, let me say there are all these microorganisms, they have developed resistance to all these antimicrobial agents. So that is why it's no longer working the way it used to, or the way it's not working the way it's supposed to work. So what are the factors that are contributing to the emergence of this resistance? And the first one is overprescription by physician. Yeah, overprescription by physicians for antimicrobial. So overprescription of antibiotics by physicians in developed countries, you know, driven by diagnostic uncertainty, or maybe patient follow-up and lack of knowledge, lead to inappropriate practices. So when you put patients on all these, it shouldn't be overprescribed. When you put patients, okay, let's say for instance, you put patients on antibiotics, you expect the patient to use the antibiotics for, let's say, for a week or maximum of 7 to 14 days. Now you are not monitoring the patient. You know, there should be some level of follow-up. Most of the time, patients will be given a particular medication and they will still be what? They will still go and buy it. Notice that sometimes when you put patients on a particular medication, immediately the medication finish, due to inadequate follow-up, they will go ahead and continue. They will go ahead and continue using that particular medication. Whereas the patient is supposed to take this medication for 7 to 14 days. The patient is now taking it for a month. That is how resistance keeps what? Building up. Or you keep prescribing that medication over and over again. So that is one of the things that affect the emergence of resistance. Then another thing is availability of antimicrobial. It is available. Everybody have access to it. People can just go to go to pharmacy, go to any professional and say, okay, can you just write antibiotics for me? Some people will say, okay, they're having abdominal pain, they'll go and buy antibiotics. You don't even know the cause. You don't even know if you're having a bacterial infection or you don't know if you're having antifungal infection, or a fungal infection, or protozoan infection. Just go ahead. You don't know the type of infection. People don't run tests. You don't know the exact microorganism that is causing the problem. They just go ahead and buy whatever drugs they feel it will work for them. So these are the reasons why there has been resistance over the year. Then human behavior, such as patient self-medication. I think I just explained that now. Then on that availability, people have access to it. There is no restriction. When you go to developed country now, you can't just go to their pharmacy and say you want to buy a particular drug. It has to be properly prescribed. It has to be properly prescribed. There is a restriction. But in developing countries, there is no restriction. They're all available. They're available all around. You can get it anywhere at any point in time. So far, you have your money. So for human behavior, such as patient self-medication, non-compliance with recommended treatment, sometimes when you place your patients on medications, that is why it is important for you as nurses to follow up your patients when you place them on all these antimicrobial agents. It is very important when you ask your patient to use medication for 5 days or 6 days. After 2 days, immediately patient gets relieved. Or your client, when they get relieved, they are no longer feeling the signs and symptoms. They will think, oh, everything is all right now. So most of the time, they wouldn't go ahead to finish that particular medication. So as nurses, when you place your patients on any medication, tell them the importance of what? Of adhering to that drug regimen. You tell them that even if there is a relief, or if they are no longer feeling the symptoms, even after 2 days, you tell them it is important for them to complete that medication. So you tell them not to stop using it. So those are the ways that we can use to eradicate development of resistance. Even if you cannot eradicate it, we reduce it to a certain extent. So it is important for you to follow up your patient to make sure that they're actually using their medication. And one funny thing about all these antimicrobial agents is that you should not overuse it or underuse it. If you do either of these, it can lead to what? Resistance. They're non-compliant, of course, when they forget to take their medication, discontinue the treatment prematurely, or they cannot afford therapy. So self-medication often involves inadequate dosing, and in some countries, antimicrobials are poorly manufactured. We have a lot of counterfeits or have exceeded their effective timeline. Then another thing is hospital factor. I hope we are still together. Are we still together? Are we still together? Okay. All right. Then hospital factors. So hospitals are breeding grounds for resistance microbes due to what? Their close proximity. Intensive antimicrobial therapy and high patients to infected ratio. Then large hospitals and teaching hospitals face more problems due to treating sicker patients. Drug-resistant organisms can be transmitted through airborne, point source, or direct contact. So healthcare workers' failure to practice simple control measures contribute to infection spread in the hospital. I hope this one is very, very clear. This one is very, very clear. You know that hospital, we have different types of patients. You have to maintain a high level of what? High level of aseptic technique when you're attending to patients. So very, very important. So by the time, there's something we call what? Hospital-acquired infection, or let me say nosocomial infection. So these are the things that can actually what, contribute to the emergence of what? Resistance. Or you place your patient on medications and then you are not maintaining adequate septic technique or standard precaution, whichever way. You are not maintaining, you are contributing more problem. You are actually giving that antibiotics more work to do, or antimicrobial agents more work to do. And there's something we call virulence. There's something we call virulence. When you have larger number of microorganisms, to actually fight them will be difficult. To actually use a medication to combat them will be very, very what? Will be very, very difficult. So the lesser the number of microorganisms you have, the better, or let me say the higher the chance that, oh, the medication you are given will work. Okay, take for instance now, you want to carry out wound dressing for a patient. Normally when a patient is having, let me say postoperative, maybe postoperatively, a patient who had injury, let me say surgical site, sorry, not injury now, a surgical site, and you want to dress the wound. And you want to make use of, you make use of all your equipment like faucet. Now, take for instance, now you are not sterilizing your equipment. And you just went ahead to use a non-sterile equipment to dress a patient's wound. And you are saying, oh, the patient is already on antibiotics. What do you think will happen? I just created a scenario now so that we can have have an understanding of what I'm talking about. You want to dress a surgical site and you are using faucet that is not sterile, or let me say gauze or cotton wool that is not sterile, and you say the patient is on antibiotics. What do you think will happen? The patient is actually on antibiotics, fine. Compared to someone who is compared to another patient who will have access to a sterile equipment and also on antibiotics. Which wound will heal first? So definitely you should know that the patient who is on antibiotics and who also have access to sterile equipment, her own wound or his own will be healed faster than a patient who is on antibiotics without a sterile equipment. Because you are introducing what? More infection. Thank you. Infection will occur. You are introducing more infection, even though the patient is on antibiotics. I'm not creating this scenario out of, okay, with my imagination. This is something I've seen in the local government. Especially by these quacks. In the local government, they will say, oh, the patient there is no problem. The patient is on antibiotics. Antibiotics will cure it. Antibiotics will heal everything. It's a lie. It is a lie because you are using a faucet or an equipment that is not sterile to clean a particular wound or to dress wound, and you expect that wound site to heal while you were busy introducing more infection. So you are giving that antibiotics more work to do. So it's actually not going to work. Even if it works, it will take time and it's going to lead to what? It's going to lead to more resistance. So I hope I'm making sense. So that is why as nurses we work in the world, let's maintain high level of what? Aseptic technique. So it is very important, our hand hygiene, when you want to attend to your patient, before attending to your patient, after attending to your patient. Maybe you went ahead to serve a medication, you touched the bed, there are nosocomial infection everywhere, from patients to nurses, from nurses to patients, from doctors, everywhere, from relatives. So you have to maintain high level of what? Aseptic technique and hygiene. Very, very important. So that you don't contribute to the emergence of what? Our antibacterial, antimicrobial resistance. Very, very important. So this is one of the factors that are leading to what? Emergence of what? Of resistance. So this is just like a diagram to represent what I just finished explaining. So impact of antimicrobial resistance. Antimicrobial resistance in acute care facilities can lead to what? Negative outcomes. You said there will be more infection, there will be wound breakdown. It will contribute to what? High mortality and morbidity. Take for instance now you are taking delivery of a patient. You are not using sterile equipment. You will introduce ascending infection into the uterus. And by the time you know it, this patient will come down with what? Postpartum sepsis. This patient will come down with sepsis. So it can increase what? It can increase mortality and morbidity. All those that are working in NICU, in when you work in NICU, and you are taking care of children, especially all those neonates, that their immunity is still very low. You have to maintain high level of what? Safety technique so that your whatever medications you are giving to them or antimicrobial agent, antibiotics, it can work. So it can increase mortality, it will increase morbidity. It will also increase the length of stay. I think I just explained that while I was illustrating with wound dressing now. There are two patients, one have access to sterile equipment and is on antibiotics. The other one does not have access. Or you are just washing it with soap. You are just washing your equipment with soap and water. And you are just sun drying them, just put them in the sun, like the way they do in all these local facilities. And you say you have put the patient on antibiotics. It will increase the length of stay. The patient that you are not making use of adequate septic technique for will stay longer. It will take time before the wound will heal. Unlike a patient whom you are making sure that, the number of microorganisms you are introducing is not much. You have reduced the virulence, you have reduced the amount of microorganisms, and the patient is on antimicrobial agent. The patient will not stay long before everything goes back to normal. So, however, these effects are limited if initial antimicrobial therapy is not effective for infecting organisms. The main negative impact is a potential risk of an organism becoming resistant to available antimicrobial therapy, particularly for common virulent organisms like Staphylococcus aureus, E. coli, and so on and so forth. Now, how can we curtail this antimicrobial resistance? So, from all my discussion, I think I've said one, I've explained some of it. How can we curtail it? How can we curtail it? What are the things that we can do as professionals to actually reduce the emergence of what? Antimicrobial resistance. Antimicrobial resistance concerns have been raised for what? For decades. This has been a major concern, a major issue over the years, with too many interventions. So infection control and limited antimicrobial use. However, previous efforts have failed due to inadequate leadership from the administration and medical staff. So the first one is infection control. Infection control, very, very important. When we control infection, it will help in the It will help to reduce all these emergence of resistance. So infection control programs are crucial for preventing hospital infection and ensuring safe patient care. They involve surveillance, outbreak investigation, patient care practice, and equipment sterilization to reduce antimicrobial resistance and colonization. So there are a lot of things that we can use. Let's make sure that we are sterilizing our equipment at when due. Very, very important. Our hand hygiene is very important. 5 moments of hand hygiene. Do we still practice it? 5 moments of hand hygiene. Even when we are carrying out the hand hygiene, are we doing it properly? The way we are supposed to do it? Are we disposing our waste adequately the way we are supposed to do it? Are we doing it? Are we making use of all our personal protective equipment when you are attending to your patients so that you don't transfer infection from one patient to the other? Then another thing is antimicrobial use strategies. In the 1970s and 1980s, tertiary care institutions in the US experienced large outbreaks of aminoglycoside resistance, gram-negative organisms, including Enterobacteriaceae and Pseudomonas aeruginosa. So intensification of infection control measures partially controlled this organism, but no improvement was observed. So by the mid-1980s, these organisms were no longer a significant issue in acute care facilities. So this is another thing that we can do, antimicrobial use strategies. Hello, are we still together, please? Someone say she can't hear anything. No, that will be from your side. Obviously not from here. So if you cannot hear anything, please check your phone, your laptop, your network, whatever. The fault is obviously not from me. So what are the other things that we can do to curtail this? By following up our patients, when you put your patients on any antimicrobial agent, what should you do? You follow it up. Follow it up. Don't just leave them to continue to use it, or you don't just leave them to do whatever they like. Some will not finish the antibiotics. Some will say, okay, the symptoms have been relieved, so they'll stop using it. So it is important for you to monitor your patients while they are on all these antimicrobial agents and educate them. You don't know how far your education can go as a nurse. You don't know how far your education can go as a nurse. Even if you cannot follow them home, or you cannot go to their houses, you cannot monitor them, then you should make sure that on discharge, when they are on any antimicrobial agents, you educate them. You tell them. That is why as nurses, you have to know mode of action of all your medications. You should be able to explain to them that, oh, these are the things that are likely to occur when you don't finish your medications. So even when the symptoms are relieved, you have to make sure that, oh, you stick to the regimen. Stick to the appropriate regimen. If you are told to, if you are asked to use the medication for 10 days, please make sure you finish your medication. So these are the ways we can curtail it. These are the ways we can curtail it. Then another way what we can do is, this might not be in our own, within our own reach, is for the government to place what? Regulations on all these antimicrobial agents, and reduce the availability. They should make sure that nobody can actually have access without what? Adequate prescription. In the developed country, I told you that when you want to access any medication, it has to be properly prescribed. And not just any form of prescription. The doctors, I think the doctor's code or something has to be on that medication, and it must be verified. But unfortunately, this is a developing country. Nobody does that. So people just go ahead and purchase whatever medication they want to do. I mean, they want to purchase. And this has what actually contributed to what? The emergence of resistance. But let's play our own role. We are more closer to the patient than doctors. So there are a lot of things that we can do. When you want to attend to your patient, don't be in a hurry. Don't say you want to close by 2 p.m. You want to quickly hand over. Make sure you observe your 5 moments of hand hygiene. Very, very important. Don't cause more harm to your patient. Your patient came to the hospital with only 1 complaint and is returning home with 10, because you have actually what? You have actually transferred infection because of your own laziness. You have actually transferred infection. Some people want to change IV medication. They will not put on their glove. I've seen it. People do it a lot. Some want to give IV medication. They will give it with their bare hand. They will not even wash their hand. I've seen nurses, professional nurses do that. So please, let's be very careful. Let's be very careful. So these are the things that are adding more. So you are introducing more infection. You might be doing it, you might not be doing that. Is negligence and malpractice. So let's do what we are supposed to do as nurses. Let's contribute our own little quota. So very, very important. Any questions so far? Any questions so far? So if there is no question, that means we have come to the end of today's class. Where can we access something? Someone just asked a question. Where can we access? I can't see the person's question again. Someone is asking where they can access it. Are you talking about this lecture? Oh, sorry, I can't see the question again. Can person please retype a question? If it's about the, what's it called? If it's about the slides, I'm going to upload the slides. I think it's on the LMS. I'm not sure, but I'm going to confirm. So I'm going to check the LMS. If it's not there, I'm going to upload the slides. And this class has been recorded. So this class has been recorded. I'm also going to upload the link on the LMS. So peradventure, you have a network issue while the class was going on, or you couldn't hear me properly, or you couldn't access the class. Please just go to the LMS and click on the link So you're actually going to find a link, click on it and listen to the class again. And listen to the class. This is my recap. I'm not going to recap. So just go and listen. The class is straightforward. The lecture is straightforward. So please just listen to the class. So thank you very much. We have come to the end of the lecture. A quiz has been uploaded on your LMS. Make sure you do your quiz. Very, very important. So thank you for listening.